Oh, yes, we are live. Mm, Yes, we are live. So sorry about what happened previously. I think I lost. Yes. So we are live. Today we are talking about emergency preparedness in for parents with sickle cell children. This is exclusive self-care cycle webinar. This is for people who are part of the inner circle that we call the Sickle circle. It's for parents who are we are in it together for a whole year, and then we'll be learning about how to support our children with sickle cell. So if you are yet to join, you can easily join before we end the opportunity to join these people by next year. We close the opportunity to join this year, so we are waiting. I and then we are live. So today we talk about emergency preparedness in for parents with children with sickle cell. Everybody understand that when you have a child with sickle cell, no matter sometimes there are some just emergency you cannot afford. Yes, I preach about prevention, prevention. But in the midst of prevention, something else can happen. A sign can show up and then you don't take notice it. An emergency, an exposure to the trigger of the crisis can happen that can cause emergency to occur. Yes. So let's say, for example, I'm somebody that cold affects so much. Cold is one of my triggers of crisis. So now when this kind of cold, let's say I forgot to close my door or my windows throughout the night, and then in the middle of the night, the degree decide to reduce, the temperature decide to reduce drastically. And I was sleeping, I didn't know, and that cold start to get into my body. At that moment that I start getting exposed, I can wake up from that sleep with pain, because while I was sleeping, I have been exposed to cold, which has triggered my crisis. It can happen. And then it means that the child can suddenly wake up in the middle of the night and start shouting. I just use cold as an example. Anything can happen. Infection, unnoticed infection, something that happened, anything can trigger the crisis and can happen at that time you were not expecting it to happen. When it happens like that, it's sickle cell. That's sickle cell for you. That sickle cell, it can definitely happen like that. So today we want to talk about that emergency, how you can be prepared for that emergency, how you can ensure that if that emergency decides to happen this night, are you prepared for it? Do you have what it takes to actually manage that emergency, or you don't? So whatever is happening, you want to ensure that, is there something that I can be in control? This is all what this emergency preparedness for parents is all about. So food for thought. If an emergency happen right now, will you be ready? Will you know exactly what to do, where to go, and what to tell the doctors? Preparation isn't about the fear. Isn't about fear. It's about power. The power to act fast, to make informed decisions, and to give your child the best possible chance in a crisis. So don't wait for emergency to happen before you prepare. Start today. Many things that happen as I have an emergency bag ready. I'm not asking for sickle cell emergency. And for a very long time, I don't think I have an emergency that I will not be able to walk by myself to the hospital. Most times, it means that even though when I notice there is these symptoms, I take myself to the hospital, walk with my leg, attend everything without that panic. Everything is packed. Earlier this year, I think January, I went through all my emergency pack, packs, and I had to remove. There are some medications that are expired. There are some medications that I realized I have to change everything. Get it that it got expired. It's something that is good for me. It's good because it shows that I didn't use it. That's exactly what made it expire. And even that, I still have to replace it because I understand no matter how prepared you are, when you live with sickle cell, emergency can happen. No matter how you are, no matter how prepared you are, emergency can suddenly happen. So you want to prepare for it. So in the process of you preventing sickle cell crisis, in the process of you preventing that complications, in the process of you doing all that, you also want to make a preparation for emergency. Sickle cell disease is unpredictable and emergency can arise suddenly. Unlike other chronic conditions, a sickle cell crisis can escalate within hours, leading to severe complications if not managed properly. Other people, when you are exposed to triggers, some triggers you can end up at the emergency room in less than 20 minutes. Yes, when some emergency happen in sickle cell, you have to be at the hospital within 20 minutes, within 30 minutes. So I'm not going to say that, oh, that's what when it happened, it's not that time you know, oh, that's what all the things that I've been doing. That's not the time for you to start complaining. That's what everything. I've been taking enough water, I've been eating the right food, I've been doing. It's time for you to take care of yourself and then come back to the drawing board and ask yourself, what exactly led to this emergency? Is it something I can control? Is it something I can ensure it doesn't happen? What exactly led to it? For the right example I made in the previously was that, imagine I opened my window in the middle of the night and I got exposed to cold. So what happened? Then the next time, it means that I want to ensure that I have my window closed, or possible dress in a way that will not expose my body to cold, even though the temperature of the room or the temperature of the day decide to drop. I can open my window and still dress in a way that I'm well covered. So even though if the temperature drops, it will not affect me. How you act during this preparation, how you act during an emergency will help you and your child A lot of people, their children will not open up their mouth to tell them about sickness, about their own emergency. Why? Because of the way you react. Hey, God, oh, hey, what happened? What have I done? Hey, you are there. You are shouting. Then the child is feeling bad. Oh, what has happened? The child is feeling like something has happened. It's because we are not prepared. So if you are prepared, you want to take control. Preparation is not just about the right, it's about even taking control of that situation, remaining calm in the midst of chaos. Remaining calm in the midst of chaos. So what happened? When there are issues, what exactly can you do? How do you ensure that problem? How do you ensure that you are at the control of this thing? Why every parent need to be prepared for an emergency? Number one, it saves lives. If you A lot of us, you don't even know the symptoms for emergency. We don't even know that there are some pains in sickle cell that screams emergency. We don't even know that this is what somebody is talking about. You're talking about a particular pain. You're talking about a child suddenly starts having difficulty in breathing. Then it's a sign of emergency. As simple as it looks, you might want to like, oh, the child cannot breathe well. And is there something I can use? There's something you can use. Take the child to the hospital. But once you know these symptoms, if you see those symptoms in the afternoon, you don't want to wait till night that you now have to start running etta scatter. Especially for my people in Nigeria, we know a lot of people don't have access to ambulance. So you have to discuss. Some people don't even have access to a car. You don't even have access to. You are not mobile, so you have to wake up somebody, a neighbor, or somebody on the street to help you take that child, and that can easily be prevented. If you notice that this child has been having difficulty in breathing in the afternoon, you don't need to wait. Just take the child, prepare, pack your bag, and go to the hospital. So immediately, if you can action, immediate action can prevent severe complications like stroke, acute syndrome. It can save lives. There are some complications that screams emergency in sickle cell. If you don't attend, and these complications can take life in hours, within a short period of time. It reduces panic. Knowing what to do in an emergency helps parents to stay calm and act fast. What you don't know, they say, is bigger than you. If you know the right thing to do, you will stay calm, because your shouting, your screaming doesn't do anything. Ensures the proper treatment. Having a medical information when you are emergency prepared, when you are emergency ready, you have the best information at hand. So you ensure the proper treatment. You know if this is something you can manage at home, or this is something that you need to take to the hospital. It builds your confidence as a parent. When you are emergency ready, parent feels more in control, leading to a better decision. In fact, your child learn from you. The moment, the outcome, the way you address the situation, the way you address the emergency that happens, they mirror it. They learn from you and also do the same thing while they are having crisis, while they are having emergency situation. So if you're always calm, talk to them gently, tell them this is the right thing to do, tell them don't worry, I've given you this, we are going to the hospital now, you will be fine. They tend to mirror it, they tend to take it, they tend to learn from you. So when you stay calm, it builds not only your confidence, it also builds the confidence of your child that believe that this can be taken care of. What are the common emergency situations that we have in sickle cell? You know, there are different kind of emergency that we have in sickle cell. What are those symptoms that scream What are those systems that scream emergency? Number one, there's something I used to tell every parent. I used to say it to us that if you how would I put it? If you are a parent and there are some materials you don't have, one of those example is thermometer. If you are a parent here and you have a child with sickle cell and you did not have thermometer, ah, you need to start asking you question, because your hand has not is not a temperature measuring tools. Yes, your hand is not a temperature measuring tools. So in case of fever, how do you measure? How do you know the temperature? Because a child that is having a 37.5 degree and someone that has 38 degree, they don't talk about the same situation. A child that live with sickle cell that is having 38 degree is screaming emergency. Is something that you cannot manage, that is something you should not manage at home. I know you want to give PCM, you want to give medication to help with the fever, but it is something you shouldn't manage. If that child is not living with sickle cell, well, you can manage it. But if a child is living with sickle cell and they have a fever that is 38 or greater than 38, from 38 upward, it could actually indicate that the child is going through a life-threatening infection. So it's not something you want to manage. That child needs to be at the hospital to be attended to. So certain health issues that requires immediate medical action. Number one, high fever. If your child has high fever that is 38, from 38 degree and above, it's an emergency situation, because it means the child it means that the child might be having a life-threatening infection. Number two, severe pain crisis. Now when you're talking about a severe pain crisis, oh, you call the child has a pain crisis, then you giving him medication at home, and then you wash. You realize that because it takes time for those medication to actually work. Let's say you've observed that child for the next 2 hours, and then in pain management, you want to combine two things together. You want to combine you want to combine both medication and non-medication method to properly manage a pain for a child living with sickle cell. So when those emergency happen, for a child has a painful crisis and then you administer a pain medication, and you have to wait for the next 2 hours, because it takes 1 hour, 2 hours before you can actually start seeing the effect of the drug, of the medications rather. So after taking that, you realize that you are giving the right dosage, you have done other things, and the pain is increasing instead of reducing. At that moment, it's already an emergency. It's something you cannot manage at home. Believe me, it's something you should not manage at home. You should not even try to manage at home. Or a child has a crisis, and the severity of that crisis is extremely high. It means that within 5 minutes or few minutes, they are already having an excruciating pain. Their pain is on the scale of 10. Their pain is on the scale of 10. It's time to take to the hospital. It's time to take to the hospital. Or you've tried other things. You've given other things and it did not work. It's time to take to hospital. There is no point for you to manage a pain. The pain is not decreasing and you're keeping the child at home for 24 hours. Why? Because in sickle cell crisis, we have other underlying conditions that can worsen pain. And if you don't take care of those underlying conditions, it can actually increase the severity and the longer time of dealing with that pain. Breathing difficulties. A breathing difficulty shows a sign of acute chest syndrome, and it can be extremely fatal if untreated. Acute chest syndrome is a complications in sickle cell. It's one of the leading cause of mortality in sickle cell disease, and it can take life within hours. So immediately you notice that a child has a breathing difficulties, you don't need to manage at home. Go to the hospital immediately. Stroke. When somebody is having a slow speech, lack of coordination, there is a lack of coordination. You just notice that there is a lack of coordination, or the person is acting confused. It can be a sign that of stroke. Sudden weakness. There is a sudden weakness that happened. This is a sign of emergency. You want to take the child to the hospital. Severe fatigue and weakness. Take the child to the hospital. Dark urine. You notice that the child has a very dark urine. Is a sign of emergency. Dry mouth, dizziness, swollen hand of feet. The hand is swollen, the hand is and the feet they are swollen. Sign of emergency. Now, when you know, the reason why you want have to know these warning signs is for you to know that, oh, this is exactly what to do. How preparedness reduce panic and improve outcome. And sometimes when we talk, there's another thing I want to, apart from the breathing, I talk about breathing difficulties. There are other signs that can also train that there is an emergency. If someone is not able to breathe well, the person is having a shallow breathing, difficulty taking a deep breath, tightness in the chest, tightness in the chest, or chest pain, coughing with or without mucus. If someone with sickle cell is coughing, it's not just an ordinary cough. Most times is a clear sign of an infection. It's a clear sign of an infection. So it is either the cough is dry with or without mucus, is a sign of emergency. If there is a rapid heartbeat, the chest is breathing extremely fast. You can feel it. The chest is breathing extremely fast. If there is a sudden swelling in the spleen is on the left side of the stomach, especially people that have children between 0 to 5 years. If the spleen is extremely swollen, then it's something that shows emergency. Severe headache. If a child with sickle cell is having a severe form of headache, if they have diarrhea and they are vomiting, diarrhea and vomiting, it's either they are vomiting or they have diarrhea, either of the two, combination or either one of the two, is a time of emergency. Now, there's a food for thought. Emergency don't set invitation. There is no place where, and before your child with sickle cell have an emergency and they are not sending you an invitation, say, see you Kemi, I am emergency, a sickle cell emergency, I will come and visit you in your house tomorrow, so prepare for me. No, emergency don't send invitation, they don't care. They happen when we least expect them. So the difference between a panic and action is preparation. The only thing that make it different is how prepared you are. Do you know? Sometimes I wonder when parents said, oh, my child cannot go to this place, my child cannot travel to this place, my child is not I cannot even allow my child to go and stay with a friend. Most of the reason is that we are yet to equip these children on how to manage emergency. I travel a lot. If I'm staying 2 weeks in a place, then I want to know the hospital around that place. Believe me, I want to know how far is the is the nearest hospital to me. I want to know the government hospital closer to me. I want to know, okay, if I have insurance, can my insurance cover it up? If my insurance cannot cover it, then what are the things? Do I have money in case of emergency? And believe me, even though that's what I'm doing all this, I already also prepare for emergency. So it means that I have medications, I have tools that can help me in case of emergency happens. And so so sorry. So if I don't know the nearest hospital to me, then how do I want to do when that emergency happen? And I need to get to the hospital as fast as possible. Yes. So even though if your child is going to be at school, if you have been doing this within them, if you have prepared them, if you have if you have teach them, if you have explained all this to them, they will definitely pick it up. They will definitely pick it up. Yes. Have you discussed an emergency plan with your child's doctor? Have you prepared the teachers? Have you prepared the siblings? Have you prepared that child with sickle cell? Have you prepared that child for emergency? Because in a crisis, every seconds counts. So we are talking about building an emergency toolkits for parents with sickle cell. Number one, your card. If you are in Nigeria and you know that by the time you are going to the hospital, they will request for card. It's not that time that you get to the hospital that you are now running up and down. You want to go and pay for card after you finish paying, especially people in that use public hospitals. You want to pay for card, then they have to bring that card. Then you have to. That's not it. So if you go to a place, you have to register for their emergency card way ahead before that emergency occur. There are some hospitals that I registered, and then when I'm leaving, I just let it there because I know that I am not staying in this place. Or I said, oh, maybe if it's a friend, please keep this for me in case I come back. In case impossible, just give it to me. I registered way ahead. It doesn't mean that I'm looking for bad thing to happen. It's just me getting prepared. And in most cases, I don't use them. In most cases, 90% of times, I don't use them. But I'm prepared. I have that card. ready. Register for the card in case an emergency occur. So you want to put it in a place where it's accessible. That time that your child is sick, that you are going to the hospital, you need to be at the hospital as soon as possible. That's the time you are looking. Where is your card? I don't even know where the card is. Who can help me to help? Who can help me with this card? Where is this? What's the hospital number? Ah, eh? No, we don't do that here. That's not what you want to do here. It's different. Some people don't know their child's blood type. Your child live with sickle cell. Either the child has collected blood transfusion before or not. You should know that child blood type. I know my blood type for a very long time. I know my allergies. I know what I react to. I know the medications I don't take. I know it. Forget these things, I know it since I was very young. It was because I was prepared for it. So there is nothing more that your child cannot know. Ask them. If they can know the name of their school, they can know how to write their name, they can know small information, they will definitely know their child's blood type. Their card, it's possible for you to write it in front of the hospital card. B positive, O positive, have it there. Correct medications and dosage, you must know it. The child must know it. The people around you should be able to know it. In case you are not around, the dad must know it, the mom must know it, the siblings must know it, the child herself or himself must know it. Allergies, medications that they don't take, medications that they react to, medication that doesn't work for them. There are people that react to some medications. So you want them to know in case there's a medication that they react to. You want to keep telling them this is what you, when you get to the hospital, prepare them. You can always make a photocopy or even snap your child hospital card, emergency card. You can have it saved on your phone. You can make a photocopy and keep in different places. And the real card should be in the emergency pack. So you can make a photocopy and put in school, put in a place, in a child's bag, a place, put in your own bag, give to people, have it snap on your phone, like that. So if emergency happen, then they can easily access that and take the child to the hospital. Pain management essentials. These are the things that must be in your emergency bag. Your card, the card must be there. Pain management essentials. There must be a prescribed pain medications that work for your child. PCN, ibuprofen, diclofenac, depending on what your child is used for. And ensure it is prescribed. Please ensure it is prescribed. If you are in Nigeria, you want to have rub, you want to have something like all these pain reliever gel, Diclomol, Neurogestics, like that, Aboniki, all those things. You want to have one. You can even have some that you already prepared. Like people that use Aboniki, you can have Aboniki and Ori and add a little bit of maybe all this gel. Have it, mix it together and have it in a pack. It is important. Have that. ORS is something that should be in your emergency bag. ORS, put it there. is very simple. Put it there. The pain medication should always written with name and dosage. Name and dosage. If the child is using 100 ml, this is just an example, 100 milligram, 10 ml, 5 ml, you want to put it, you want to have a paper and write the dosage of each medication and put it in that bag. See, you can have different bag and maybe drop one in the school clinic, explain to them on how to use it, have one at home, and if the child is traveling, prepare one that they can take to travel with them. Wherever they are staying, have the discussion with them so that they know what to do. And also, if they're staying with a guardian, there, explain to them, because it's not every time you can follow the child to everywhere they are going to. The reason why you must have ORS, in case there is a vomiting, there is extreme dehydration, there is a diarrhea, you want to have it in the bag for easy hydration. Thermometer. Thermometer is something that must be inside that your emergency bag. Thermometer, so when the child has fever, they don't need to start running up and down. You want to just easily dip your hand inside there and check the temperature of the child. Thermometer. Pulse oximeter, that one is not compulsory for everybody, especially when you are in Nigeria. A lot of people don't have it, but you can have it. It helps to monitor oxygen level for, especially for breathing issues. If you have it, it is good, but if you cannot have it, it's fine. If you have it, it is good. You can have it, it's not that expensive. Bandage, hand sanitizer, gloves, have it inside the emergency bag. And you want to have other things inside that emergency bag for people with sickle cell. Pain medication, if you can have it. Pain medication, I talk about the pain medication, the oral one. You can also have maybe their IVs. If you use public hospital, you want to have their IVs, you want to have their cannulas, you want to have plaster, you want to have cortiwool, you want to have the normal saline, one or two, you want to have dextrose, saline, one or two, have it packed inside that bag. Cannula, the cannula that you know is easy for your child to use, have it two, at two or three, have it. Gloves, have it inside. Cortiwool, have it. Spirit, methylated spirit, have it inside the emergency bag. Have it. IV line, have it. Those are important. Then you might want to have contact list. When I said contact list, that contact list must have your doctor, your nurses, people that usually attend to you. It's okay. If you don't have it, it's fine. But if you have it, it's a plus. So you can easily call them and ask, tell them, okay, you're on your way, this is what you have done, and let them be aware of what you have done. Then you might want to pack a hospital ready bag, ready to go. In my own, I have a bag that contains everything. So I have a change of clothes in case I'm going to the hospital. I have books. In fact, I usually pack books when I'm going to the hospital. I have books, maybe toy, it depends, storybook, it depends on you. You might want to have it. The snacks, you might want to have it ready. That's for you. Then all these things that is inside your emergency, always have it in a particular place that is easy to get. In case there is an emergency, you can easily, because that bag is already packed, everything is fully packed, you can easily pick it up and go to the hospital. And in case if there is something that happen, if you want to take pain medication, go to that same bag, easily pick it up. use it, attend to the child, and then return everything back. It is very, very important. Hmm? Emergencies are unpredictable, but your response doesn't have to be. Will you be ready if your child had a crisis in the middle of the night? Look at yourself, sit down now and ask yourself question. If your child suddenly have fever in the middle of the night and you need to do something to help that child reduce the temperature, their body fever, um till tomorrow, till the next morning before you go to the hospital, do you have things ready to give? Do you have it ready? Do you have it ready? Eh? Do you have it? Check. You want to check, and then you want to update these things. You want to check for the medications. You want to see if there's something missing. You want to check for the expiry date. You want to do all these things once in 3 months or once in 6 months. For me, I usually go for a medication that has a long shelf life. So you may want to do it so that it reduces the way you check. But irrespective, you still want to check like maybe every 6 months. Look at what you have used in the past 6 months. If you did not use it, it's good. Then, but still check. Is there something that has expired? Is there something that I need to change? Is there something that I need to be updated inside this emergency pack bag? So if your child has a crisis in the middle of the night today, what will you do? How are you going to respond to it? You are just sleeping. Everybody has said good night. Everybody is sleeping. You are enjoying your night sleep, and then your child suddenly comes, or maybe called you on phone, or somebody decided to wake you up and said, "Mommy, I'm in pain." Or so person has been in pain. How will you react? Do you want to shout? Do you want to scream? Do you want to lose control? What exactly are you going to do? Now, these are the things you need to do. If your child happen to have a crisis today in the middle of the night and you are called, what the first thing I want you need to do is to stay calm and assess the situation. Where is what exactly is happening? Where is the pain? If there's pain, if there's other symptoms, you want to check, you want to ask question. Stay calm, calm this child. Sorry, how do you feel? Mommy is here. What do you want to do? Daddy is here. Depending. So because it's not just only about mommy. What, where are you having your pain? You want to assess your back. Reason why you have to assess is that you want to know the symptoms that require you. Do we have to get to the hospital immediately? Do we have to give a first aid before going to the hospital? Depending on your country. If you are in Nigeria, you know that it's not easy for you to go to the hospital in the middle of the night. So you want to calm the situation. You want to do it, do something you can do till the next morning while you can go to the hospital. Yes. So you want to ask how severe, if it is pain, you want to ask where is the pain, how severe is the pain on a scale of 1 to 10. What, how painful is that? It is important for you to teach your child to use scale to be able to talk about their pain, because that gives you the opportunity to assess the pain. So on a count of 1 to 10, 10 being the highest, 1 being the least, how severe is your pain? So if your child said 20 over 10, yes, it's possible to say 20 over 10, it's possible to say 10, then you know that the situation is very, very severe. It's an emergency. So you want to find a way to immediately give a pain medication, start to hydrate immediately, then use other method. You want to use maybe hot water, you want to use heat, you want to use what is it called? You want to use all this pain relief gel, other things. You want to do that to help ensure that you are reducing the pain while you are waiting for, you want to use distraction method, because while you are waiting for that medication to work, it can be slow. It depends. While you're waiting, in that period where you're waiting for the pain medication to work, there are other things that you need to do. Hydrate, use non-pain medication. So do you have a warm, a heater? Is there something you want to do? Or you can use a normal method. Do you have a hot water bottle? You want to prepare the hot water bottle and place it where the child is having pain. If you don't have it, you can use a natural method where you use your towel or cotton cloth that can absorb a lot of heat. Then you use your hot water, place it inside, squeeze out, and then use the heat from that cotton or towel. Use it so that the child can easily take that heat. Then you want to use a distraction method because they are taking their medication. You've used other things. Maybe you have used your rub, um, your gel, pain relief gel, spray, splashes, depending on the situation, on what is available for you. After you have applied that, then you want to wait. You want to distract them because it takes time for all these things to start working together. So you want to distract them while you are assessing the situation. Then you want to ask after 1 hour, is the pain increasing or is it decreasing? If the pain is decreasing, then it shows that this is something that you can be managing at home. If the pain is increasing, it shows that this is beyond what you can manage at home. Then if this is a sign of fever, a child is suddenly having chills, cold, fever at the same time, you want to check for the temperature. If the temperature is at 38 and above, it already shows that the child needs to be in the hospital where they can be admitted. It's showing it could be a sign of infection that needs to be attended to as soon as possible. If the fever is lower than that 38, then it means that you want to give them a fever relieving medication like your paracetamol, depending on what is available or the brand that is available for you. You want to give them fever reducing medication to help them reduce that fever. Then you want to do other things, maybe using towel to calmly rub their body so that it can bring down the temperature. If they have a chest pain, if they have a chest pain and difficulty in breathing in difficulty, it shows that at that time you want to find a way to ensure that they get to the hospital at that night. It is screaming emergency and you might not be able to manage it. If the child suddenly have a very dark urine, you want to hydrate once as possible. While you keep hydrating, you keep monitoring the color of the urine. If you hydrate for the next 6 hours, 7 hours, and there is no change in the color of the urine, it is time to go to the hospital. It is time to go to the hospital. If the child is having a sudden weakness, is dizziness, they have a pale skin, severe fatigue, it's either a sign of anemia or something else. So you want to take to the hospital for other purpose. But at that time when the child is having other, you must be calm to be able to assess the situation. You must be calm, assess, ask question, where, when, how painful it is, what is happening. You want to know the places where they are having those discomforts and you want to label it. Then you want to assess it with different different, what is it called, you want to assess it to know if this is emergency or not. Like I said, please, while you are giving pain medication at home, do not overdose. Do not overdose. Only give the normal dosage at one point at a time. Like one of the things that people do is that if the highest dose you should take in a particular medication is two, is let's say 100 milligram. After you take 100 milligram and the pain did not reduce after 2 hours, then it shows that that particular medication is not enough to take care of your pain. Don't go and take 200 milligram in place of 100 milligram. That is an overuse. That's a That's overdose already. You are overdosing on your medication. So please do not over medicate. No matter how painful, no matter how, I know that it's not easy watching your child to be in pain. You might want to try everything. Please do not over medicate. I just got to beg you, do not over medicate. In case it is pain, the first thing you want to do is to assess the pain, know where the pain, know how severe the pain is, give prescribed pain medication, give what, hydrate, 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 hydrate. Warm compress, eating pad, hot water bottles, depending on what is available. You can easily make a hot compress using your hot water and towel, depending on what is available for you. If it is fever reducing medication, use a cool, not cold towel on the forehead, or use it to rub all the body. Use a pulse oximeter to check the oxygen level. Oxygen level below 92% means you need urgent help. Now when you are assessing the child, immediately I said assess the child, assess the you want to know, do we have to get, you need to know when you have to get it. If the child is having a difficulty in breathing and chest pain, please, I did not encourage you to manage at home. I do not encourage to get at home. Find every means available to you to send the child to the hospital in that period. Please find every means available to you to take the child to the hospital. Now, during emergency, when we go to the hospital, there are so many issues that happen because at that time our body is tense. There is this a lot of anxiety, and it often causes clashes between parents and the medical staffs. So while you are going to the hospital, you also want to be calm. And this is the situation because at that time you are setting my dream all over the roof. That's where the emergency pack that you are prepared already comes handy, because you just pick it, everything is already there, the card, whatever you need at the hospital is already settled. Just take that bag, go to the hospital, and then as they are asking you question, you want to ensure that you are very very fast. No matter what you have given to the child, you want to explain to them. If you have given a particular medication at home before coming, you want to explain to the medical doctor whatever thing that you are giving to that child while you are at home. You want to explain to the medical doctor. If there's any other thing, if they have allergies, you want to tend to them. You also want to speak with a lot of confidence, without anxiety, without creating a lot of drama. You want to be as calm as possible, because see, you are trying to have a conversation with a medical doctor. It's not the time that say, doctor, do you want to kill me? Do you want to do this? Doctor, you can realize that we see when we get to the emergency room, emergency differs. Yes, emergency differs. For people living with sickle cell, it's an emergency. But if there's somebody that is maybe like an accident victim, for example, that needs to be, I'm just trying to say, there's a lot of emergency that happen. Maybe and then they realize that the child is a little bit stable than that person. They will want to attend to that person that is screaming is more emergency than that person, even though we all know that sickle cell crisis is an emergency. So please, you want to go there as soon as possible and ensure that you explain, talk about the symptoms. It's important for you to know when the symptoms started. It's important to know to note the medication you are giving. It's important to know the pain level. It's important to know to tell the doctor if there's any allergies that the child has. And when you are teaching all that, you must also teach your child on how to undo it. So advocating for, if there's something you realize that the doctors are not doing well, it is important to advocate for your child health care. You have the you see you have the you have to be on top of your work. See, you have to insist, because see, a lot of people might want to dismiss the pain of a child with sickle cell. They might want to dismiss it. You as a mother, you as a parent, must be able to put down your feet and demand the right thing for your child. You must be able to know what are your rights as at the hospital. What is the right of your child? Ensure that the child is having a proper treatment. If they are not giving a proper treatment, see, you have the right to leave that hospital, request for a um you request for a transfer. Let them transfer the child to another hospital that you feel like is capable. You have to see, when you are having a conversation with a medical doctor, you don't need to scream. You don't need to scream. If they realize that you know what you're saying, they will definitely listen to you. You don't need to scream. You don't need to panic. You don't need to be insultive. You don't need to do all that. You don't even need all that. Just ensure that you place your concern as fast as possible. If you are not getting any relief, talk to a senior person at the hospital who can actually help you. Emergency don't come with a warning. The best way to protect your child is to be prepared. What child can you do? So if your child spend times with different people, like I said, you must also find a way to educate your teachers. If the child is spending time in the hospital, you know that at school, emergency can occur in school, and family members, the siblings, the people that stays around with you. If you have a nanny, if you have an house help, you also want to carry them along to let them know what they can do. Tell them about the emergency symptoms. Let them know these are emergency. These are the things we can manage at home. These are the things that we cannot manage at home. Then another one thing that is very, very important is that while you are preparing your child, it's important to do a role playing. We take it a lot. Some people said, oh, you want to role play, you want to ask your child. So now immediately, your child, if you have children that are maybe 5 years, 6 years, and you can absolutely prepare them. You want to play a role with them. Let's assume I'm a medical doctor. You can even do a role play with your other children, assuming the child is not feeling sick. You might not use the child, you might use another person in the family. Let's assume so person is having an emergency. How do we act as a family? Let them pick a scenario, let them act it out. That prepare them. You are constantly preparing their brain for that activity. You are constantly preparing them. Teach them how to know. So you see, people go to emergency room and they hide about having sickle cell. How? Why are you hiding? Why do you have to hide the fact that your child live with sickle cell? It's still something I don't understand, but it happens daily. You see parents that brought a child with sickle cell and then they are complaining they are not giving the child. And by the time you notice, you realize that the parent did not even open up and say that, oh, my child live with sickle cell. If you say your child live with sickle cell, every of the symptoms the child is give makes it totally make it easy for them to get the needed help, or for them to get the necessary support that they need. So you don't want to hide it. So have the teachers, you might want to tell the teacher, oh, in case so happen, this is exactly what you should do. In case this happen, this is what you should do. In case this happen, this is how you should handle it. Teach them. And for the sibling, have a role playing, because children will never forget that. When you role play, when you bring them into it, they learn so much with play. When they learn so much with storytelling. So when you bring the child and you allow maybe even the child that live with sickle cell, you want to role play with them. Act like the doctor, let them act like the patient. So you have an emergency. How do you deal with the situation? Imagine you travel out of the town to stay with a friend in another community, and you suddenly have crisis. How do you handle the situation? Create a scenario that can happen. A fever at home when you are not around. Yes, if they have a trouble breathing in a family gathering, what can they do? If they are in school and they suddenly develop a sudden pain, what can they do? You want to know that. You want to understand that. So you want to ask your question, how do you feel? How will you describe your pain? Who will you call first? Who will you tell the person that is helping you? All these things help your child. You want to ask them for information. Okay, you want to tell them how to describe their pain. Tell them with scales. I have because the doctor would definitely ask. So you are role playing with the child. The more you role play with the child, the more whatever that situation stick to the child's brain. It stick to the child's brain. The more you do role play of different scenario, that is the best way to train to actually teach your child what to do. And every time they go to the hospital, give them the opportunity to talk, give them the opportunity to express themselves, give them the opportunity to learn how to describe their symptoms in a way that in a way that they can understand. So teach them, help them to put a label, help them to put a name to whatever is feeling them. If they tell you, oh mommy, I feel tired, let them be able, when you role play with them, you are teaching them how to constantly have a conversation with their teacher, with their doctor, with their friends, with people, with other people. And it also build their confidence. Please, you also want to prepare the siblings and the friends to support your child. How to spot an emergency. Imagine if you don't train, whatever you don't teach, people will not know. So even though if the siblings are with them at home, if you are not teaching them how to spot an emergency, they might not be able to know. So if you notice that a child with sickle cell suddenly have a yellow eye, somebody that always have a clear eyes, the eyes is suddenly yellow, then it's a sign that is telling you that something is about to happen. And then you want to like maybe take them to the hospital, hydrate them, test, ask for a routine test so that you are able to know it. So this is going to be the last food for thought. Emergency don't wait for us to be ready. There is no emergency don't wait for us to be ready. The best way to protect your child, the best way to protect your child is to prepare in advance. The best way to also help everybody in the family is also to get everybody ready to prepare. What's the action you will take today to make your emergency plan ready? So whatever you are doing, what are the things that you're going to do to make the emergency plan that you already have in place? What are the things that are not in your emergency plan that you need to place? What are the things that you have that you need to upgrade? You see that you did not have thermometer, it's time for you to go and get thermometer. Is it that you did not have your pain medication ready? It's time for you to have it. Whatever you need to have, it's time for you to have it. So this is going to be the end of the class. I want to say thank you to I want to say thank you. Um I want to appreciate everybody who has been here since morning. So there's going to be a replay. You can always get access to the replay. Please do not forget to catch the replay and leave your comments in the. I will always attend to it. So thank you and goodbye. Bye.